Your sales numbers beat estimates. The earnings are looking well. But I'm interested in the language that you use. You talk about 2015, a modest sales growth, and I noticed that your margins are dipping in healthcare. Is there a cautionary message from you there, Frans?
Well, I characterize the quarter as good progress. I'm encouraged by the modest growth in healthcare that returned to positive growth, also on order intake. But I do see a world where China is still slowing down. And because of the healthcare reform in the United States, we are still seeing hospitals sitting on the fence when it comes to procuring medical equipment. So this year, modest growth, I think, is indeed a cautionary outlook. When I look at the lighting division, on the one hand, 25% growth in energy-efficient LED lighting, that's great. But the conventional business, and that's the flip side, was declining. What stands out in the first quarter is our consumer lifestyle business that grew by a whopping 10% and also expanded margins on the back of locally relevant innovation, the Sonicare for Kids toothbrush, for example, that we introduced.
Yeah. But Frans, you're betting the house on health, sir. It's $125 billion. You're number 3 in the game there against GE and against Siemens. You are betting your reputation on health. That worries me. Your language and the numbers worry me that you're making this bet and you're promising the market a growth rate of 4 to 6%. You're also promising margins of 11 to 12%. That doesn't sound like a CEO that's really on track to make those if you're cautionary on the United States as you are.
Well, health for us covers everything from healthy living to preventative care, diagnosis, treatment, and aftercare and chronic disease management. Our consumer health and well-being business grew by 10% in the first quarter. So I think that bodes very well. Well on track, also incorporating all the measures of our Accelerate program to the letter. On the health care side, indeed, we still have more work to do, hence my more cautionary outlook of modest growth. But we are convinced that we are on the right path. We were able to record a big order from the Kenyan government to upgrade the health system in Kenya. We were selected by Providence Health and Services in the United States to do their healthcare informatics. Big data is becoming more and more important, and our customers are focused on clinical outcomes, and Philips is really good at building that bridge between the clinical evidence and how to support providers in delivering better care at lower cost. So I think we are well positioned with our health tech strategy going forward, but we also still have work to do. As you recall, we are just coming out of a situation where we had to improve our quality management systems. Our factory in Cleveland is producing again. We are shipping to our customers, but I know that we still have more work to do, and hence my cautionary outlook with modest growth this year, and then we'll step it up again in 2016. And in January I talked about how we look at our targets for that year.
Frans, can I ask, I want to go on this journey with you. I want to believe in this. My personal spending on health, that must be part of the Philips dream. What do you see individuals spending on health with your company in the next 10 years? If I want to be more healthy, what's the paradigm thinking? How are you going to get me to treat your consumer health business like an Apple product? Is that the dream?
Absolutely. We see consumers more and more engaged on their own health. And at the same time, from a societal point of view, the health care burden is rising. Now, the world population will grow from 7 to 9 billion people. With a bit of luck, we will all live to 80 or 90 years old, but we have to cope with more chronic disease. In the United States, healthcare.
And Frans, I want to tie it down. What do you think I'm going to spend as an individual? What am I going to spend? Am I going to spend $100, $200, $300, $1,000 on my health? What's the number?
Well, but you are spending thousands of dollars right now, and you may not realize that, but that's through your insurance premium and through your taxes. And we predict that that consumers, patients, will be held more accountable for their health in the future. And if you live a healthy lifestyle, thanks to, for example, our healthy living products, you will actually be able to get a discount on your insurance premium. And the flip side of that is that if you don't take care of your health, actually, maybe you will see the penalty of that.
Frans, you've also made a very clear statement to the Telegraph in recent days, and we are very focused, 10 days to run on the UK election here. You're the CEO, you hire 1,800 people here in the United Kingdom. If Cameron calls for an EU referendum, would it really delay investment by Philips in the United Kingdom? And what I'm much more interested in, so answer A, and B, what I really want to know is, should Europe change? Is Cameron right to call for change in Europe?
I think those are two good questions. Well, let me first clarify that my statement comes out of my passion to see a strong Europe. I cannot just imagine a Europe without the Brits. So I'd like us to stand together in our journey to have an innovative and economically prosperous region. Now, can Europe become more pragmatic? Undoubtedly. I think we are all discovering how to run this region really well. I've often gone on record to say, we need to step up innovation. The Lisbon Agreement called for more R&D investments. Philips does that. We are strongly committed to investments in research and innovation. By the way, also in the UK, where we have our research facilities, and we are very pleased with the talent in your marketplace. We want to continue that. And I think we should do that without distraction. So let's stand together and make Europe a better place.